Good afternoon, friends, and welcome to Cleveland.com's Guide to Medicare event, proudly presented by Medical Mutual. My name is Eric Holcomb from Cleveland.com, your host for today's program. Navigating the complexities of Medicare plans can indeed be a daunting task, but fear not. Our experts today are joining us with a single mission to simplify and demystify the entire process. So whether you're a seasoned Medicare beneficiary or someone just starting to explore your options, our experts are equipped to break down the information into manageable, understandable pieces. So get ready to absorb valuable insights, engage in discussions, and participate in the live Q&A sessions. And by the time we conclude today's event, you'll be well prepared to make informed decisions about your Medicare coverage. Now, we know you have burning questions about Medicare, and we want to hear them, so do not hesitate to share your questions in the chat or the Q&A box. You can do it right now and right here on Zoom. Our team of experts is ready to respond either through direct chat replies or during the dedicated Q&A segments on the virtual stage. And your questions and the answers will be compiled into an email that we will send out at the beginning of next week. And this comprehensive document will also include not only the Q&A, but other valuable resources provided by our experts. Quick tip, I know we've all done this before, but remember, as you are sending in questions either in the Q&A or specifically in the chat, make sure you're picking all attendees and panelists, because then it will be shown to everybody, not just me. Now, if you forget to do that, no worries. I will get the questions to Julie Washington, and they will answer them in some way, shape, or form. Now, before we delve in today's enlightening program, we want to express our immense gratitude to our sponsors, without whom this event would not be possible. A big thank you to Medical Mutual and the Ohio Department of Insurance. And for more information about these fantastic partners, check the chat or visit the event website. And now, a short message from Medical Mutual.
Medical Mutual is the right call for Medicare Advantage.
Zero copays, lower deductible, and all my doctors are in the network.
Benefits like $0 monthly premiums, $0 copays on primary care and specialist visits, and $600 in free groceries make Medical Mutual the right call.
My name is Vicki, and Medical Mutual is my Medicare Advantage.
Make the right call for better Medicare benefits. Medical Mutual, Ohio's hometown Medicare insurer.
Once again, thank you to our fantastic partners. Now, a quick sneak peek about what we're going to be doing over the next 90 minutes. First up, Christina Regg from the Ohio Department of Insurance will provide us with a solid overview of Medicare options and the different plan parts, ensuring that we all understand what is covered under each type of plan. Next, our experts will guide you through how to choose the right Medicare plan for your individual needs. And following that, we'll dive into what to consider when selecting a drug plan. During this segment, our experts will walk you through the changes to Part D for 2025 and explain what these updates might mean for your coverage. Guiding us through these important conversations is my esteemed colleague, Julie Washington. As a healthcare reporter at Cleveland.com and The Plain Dealer, Julie is renowned for covering major news stories and offering insightful commentary. And remember, as we said, this webinar is a great opportunity for you to ask your questions. Submit them in the chat or the Q&A box, and our experts will do their best to make sure they answer them. Now, let's get this show on the road. It is our privilege to introduce our first speaker for today. Please join me in welcoming Chris Regg, the director of the Ohio Senior Health Insurance Information Program, OSHIP, to the virtual stage. With over 25 years of dedicated service at OSHIP, Chris has been at the forefront of educating and assisting Ohio's Medicare patients. As director since 2012, she's worked tirelessly to ensure that the education and outreach are accessible and equitable across the state. So without further delay, let's give a warm virtual welcome to Chris Regg as she walks us through the essential aspects of the Medicare plan. Chris, as always, it is a pleasure to see you. How are you, my friend?
I'm well. Thank you, Eric. Thank you for having me back. I am, as you said, the program director for OSHIP with a P, that is the Ohio Senior Health Insurance Information Program, a division at the Department of Insurance to provide objective and unbiased information. So it's my honor to kick things off tonight with just kind of that really high-level view of what Medicare is. So if you're 65 and older, any age and disabled typically for 2 years, or someone diagnosed with end-stage renal failure or Lou Gehrig's disease, you are eligible for Medicare. We do a lot of welcome to Medicares for folks who are aging into Medicare. So a quick note for those that are working past the age of 65, you may be staying on your employer plan longer and joining Medicare a little bit later. Regardless, once you are eligible for Medicare, you have two very general options. And this is really what we're diving into tonight. Option one is for folks who still use their red, white, and blue Medicare card as their primary insurance. Original Medicare consists of Medicare Part A and Medicare Part B, as in boy, working together to cover the majority of your health and medical needs. Now, as many of you already know, original Medicare by itself, that red, white, and blue card, does not pay for 100%. There are copays, there are deductibles for both Part A and Part B benefits. Most individuals that are utilizing original Medicare have some type of secondary coverage to help pick up what Medicare doesn't pay for. Some may have a group health insurance plan, GHI. Those are becoming fewer and fewer, but some have retirement benefits that actually pay after original Medicare. Others, with limited income and limited resources, may qualify for Medicaid to pay after original Medicare. The majority of folks that we speak with, though, typically are shopping for private insurance to supplement Medicare. So if you look under that option one, we know original Medicare is the primary payer. Secondary insurance can consist of Medicare supplemental insurance or MedSup or Medigap. It's all the same thing. This is private insurance that you purchase to pay after and only after Medicare Part A and Part B. Now, I'm stressing that because supplements are often confused with the Advantage plans. If you have a supplement, you may have shopped for that when you were new to Medicare. You may be set with that plan for the rest of your life. As long as you pay your premium, you will always have that coverage. Medicare supplements do not have a network of doctors and hospitals and providers that you must use. Essentially, if Medicare Part A and Part B pay the claim, your supplement will pay also. So it's good throughout the United States with doctors, providers that accept Medicare. Now, it's no longer just those two cards that are in your wallet. There is a third card for prescription drug coverage. Some, again, may have great drug coverage as a retiree, maybe as a veteran. But again, most to have drug coverage are shopping for Medicare's prescription drug benefit known as Part D. And it's available in the standalone plans for individuals who have original Medicare. So as we go into 2025, we're going from about 20 plans down to 14 plans. So as we get into this slide, it's know where you're at right now. Are you currently in original Medicare? What is your secondary coverage and what type of drug coverage do you have? Or are you in option two? Have you joined a Medicare Advantage plan? Right? We just saw the MedMutual ad. That was for Advantage plans. Advantage plans replace your original Medicare benefit. They replace the need for a secondary insurance. And they often include the prescription drug plan. So it's all the benefits in one. You may have heard of this called Part C. The C is for choice. You can choose to receive all your Medicare benefits from this private company. Medicare Advantage plans, like Part D, contract with Medicare for 1 year. So every year, it's very important to review your health and your prescription drug needs to see if you need or want to make a change. So as we go through tonight, hopefully, first of all, you know what you currently have. If you have original Medicare, a secondary, and a drug plan, or are you in a Medicare Advantage plan? The second step is, have you received your annual notice of change and other information detailing important changes for 2025. That's our starting point for shopping for plans going into 2025. For the first time ever, we're about 50-50, but slightly more Ohioans on Medicare are in the Medicare Advantage plans. So it's very important that you've checked your mail. If there's changes coming to your costs or your provider networks, now is the time to shop. So I want to thank you for giving me just a few minutes to provide kind of an overview or an introduction into the night, and I look forward to answering your questions.
Thank you, Chris. As always, that was awesome. And you just showed us all of the stuff that's going to be available on the resource page. The link to that page is in the chat, and we'll also send it to you via email after today's event. So let's dive a little bit deeper into the discussion and figure out what the right plan is for your needs and what coverage you need to have. And for that conversation, Chris will stay here, and we'll also invite to the stage Amanda McFarland from Medical Mutual. Amanda is the individual sales manager for Medical Mutual, supporting the Medicare and individual markets. Amanda has been with Medical Mutual for more than 7 years and more than 20 years of experience in the Medicare industry. And let's make sure we put all of the questions you have in the chat or the Q&A box so we can get them to the speakers during this Q&A. So without further ado, Chris, who is already here, Amanda, welcome to the show. And Julie Washington, the stage is yours.
Hi, Christina. Hi, Amanda. And hi, Eric. Thanks so much for being with us today. Let's dive into some questions. Chris, this one is for you. When does the enrollment period start and end?
We are in it. The open enrollment every year is from October 15th until December 7th.
Really? The dates don't change? I wasn't aware of that.
Yeah, every year. That's why it's very important. Ohio has over 2.5 million Medicare beneficiaries, and we want every one of them to review their health and drug options. And then if they need or want to make a change, they can enroll anytime between October 15th and December 7th. Any changes will take effect January 1st.
Okay, so we can all put that in our future calendars. All right. And Chris, the next question is also for you. What are the most common eligibility periods for Medicare plans?
Yeah, the enrollment periods could probably be a whole day session on their own. What we find out, you have folks that are going to be new to Medicare, and we welcome over 100,000 new Medicare beneficiaries in Ohio every year. So generally speaking, when you're turning 65 or maybe you work past 65 and you're dropping that current employer coverage, you would have an initial enrollment period. And that typically spans 7 months around your 65th birthday. We encourage folks that if you're turning 65, make sure you start applying for your benefits at least 3 months prior. So everything starts the first day of your birth month. And then every year, we want you to use October 15th to December 7th to review those options. Once we get into the new year, if you're in a Medicare Advantage plan, there is a Medicare Advantage open enrollment from January through March that does allow you to make a change.
Okay, wonderful. Amanda, who needs to enroll or re-enroll in Medicare?
Sorry. The only people that really need to take action right now are people who want to change their plan. So if you're in a plan and it hasn't changed and you're happy with that, then you can maintain the current coverage you have by not taking any action. But to Chris's point, this is a really important time of year because all of the carriers' plans do change every single year. So just because it fits your needs for 2024 does not mean that it will in 2025. So we would recommend reaching out to an agent, reaching out to the Ohio Department of Insurance, visiting, one of the trusted resource sites like Medicare.gov, and making sure that you're looking at those options and that nothing has changed and you're in the best plan. Now, if the plan is still your best option, then you don't have to do anything to enroll or re-enroll.
All right, and this is a good follow-up to that, Amanda. What are the key factors that a person should consider when choosing a Medicare plan for 2025?
Yeah, so there's a lot of things to look at. First, probably the two things that all meetings would start with are your prescriptions, like making sure that your prescriptions are covered on a carrier's formulary. So each carrier covers different medications, each carrier covers them at a different cost. So making sure that those drugs are covered and that it's at a cost that you can afford. And then also the second one would be, are your providers covered under the Medicare Advantage plan? So Medicare supplement, completely different conversation. The network's going to be the same with every single carrier because we follow Medicare's network, but Medicare Advantage, it's going to be different from carrier to carrier. So you want to make sure that the providers are in the network. And then kind of once you have those two things firmed up, then you can start getting into the nitty gritty of the benefits. So what's my max out of pocket? So that's like your worst case scenario. What do I pay when I go to the doctors? You could have a zero primary care and zero specialist, for example. Those types of things. Do they have dental, vision, hearing? You got to look at what do you know you're going to use and what are most important to you after you get past the Part D, the prescription drugs and the network piece.
Okay. And just to be clear, carrier is a health insurance plan?
Correct. So somebody like Medical Mutual, yes.
Okay, great. Chris, how has Medicare changed for the 2025 enrollment period, and what should enrollees be aware of? Because we know there are always changes that we have to be aware of.
Yeah, and this really ties nicely to Amanda's answer. All those things to look at in a plan is what you should be looking at every single year. I know mailboxes are being flooded with marketing material, but it is very important to pull out the important information from your current plan, such as your annual notice of change, because you want to see if your specific plan costs are increasing. The other thing you might be receiving are notices from your current provider or hospital systems, notifying you that they're using this time to determine they're not coming back into network. Those are great indicators that you should shop around and then look at, the cost, the coverage, the convenience of these plans, in addition to some of the good changes you're going to hear more about as we get into this evening. When we're shopping for Medicare prescription drug plans, there's now a cap on the out-of-pocket costs at $2,000 that Katie's going to go into more detail about. There's, a lot of good things happening with the Medicare coverage. It's very comprehensive, but it has to be the best plan for you as an individual. And, a lot of this is repeat because it's important. Reach out to a trusted source, your local agent that's there to for your community. The SHIP who is providing objective and unbiased information at the Department of Insurance. I always take the opportunity to say, don't just pick up the phone from an unknown caller or call a random toll-free number that you see on TV. Typically, those folks aren't interested in helping you determine what plan is best for you rather than just making a quick enrollment.
Okay. And now we all have different out-of-pocket costs that we have to be aware of when choosing a plan. Chris, what are the most common out-of-pocket costs that people overlook when they're selecting their plan?
We often get calls from folks, just give me the cheapest. And they're often referring to the premium. And that's dangerous because you really want to take into account all costs throughout the entire calendar year when you're looking at these plans. Take, for example, Medicare Part D. We have zero premium plans. However, what is the actual cost for your medication? Is there a deductible where you're going to pay the full amount of money up front before the plan kicks in? What are the actual co-pays once you're in that coverage? Now, good news, there's no more donut hole. We don't have we just have coverage for the rest of the year, so it makes it a little bit simplified. And are you going to hit that $2,000 cap? Similar for the Medicare Advantage plans. Is there a monthly premium that I will pay in addition to my Part B premium? Are there any deductibles? That's rare, but there could be a deductible. And then what are the actual copays and coinsurance for those services that I'm likely to use? Our goal at OSHIP is that you just make an educated choice. You know these factors before you sign up, so you're not blindsided by costs when you utilize it next year.
Yeah, education, that's what this whole session is about,
Yeah.
right? It's so important that the plan that we choose has our preferred doctors. Amanda, how should one evaluate whether a plan covers preferred doctors, hospitals, and medications?
Yeah, I think you'll hear us repeat the same things over and over again. So Medicare.gov has a great tool if you kind of want to do your research yourself. You can go out there and enter your medications and it'll give you like the cost of everything. One thing I do want to call out, and I know that we'll dive into the prescription drugs more, is I think that everybody keeps hearing this $2,000, $2,000. And that is true, but it's $2,000 for carriers covered drugs. So making sure again that those drugs are on the carrier's formulary is very important because if it's not, then it doesn't apply to that 2,000 Part D cap. So making sure that you're doing that. So Medicare.gov, if you wanted to do your own research, I'm going to tell you, I've been doing this for 20 years and I still get questions that I don't know the answers to. So I would recommend OSHIP or reaching out to a local broker that specializes in the Medicare market and having them sit down and like customizing. Brokers, independent agents work for multiple carriers or health insurance like medical mutual companies. So they can really kind of look at all the carriers out there and see which one best fits your needs.
Hey, how can you find a broker like that?
Yeah, so you can call OSHIP, you can call Medicare, and they have a list. We also have a list of some of our agents on our website, and we can definitely share that link following this event. Or you can contact the carriers directly as well. Most carriers also have their own internal agents that can help them with the carrier's plan as well.
Okay, fantastic. Chris, here's a basic question, but one that's very important. Is it possible to receive both Medicare and Medicaid? And maybe you could start off by explaining what the difference is between Medicare and Medicaid.
Yeah, they're often confused. Medicare is health care, health insurance provided by the federal government for individuals 65 and older, those with disabilities and specific illness. Medicaid is aid, like Band-Aid, farm aid. If you have limited income, limited resources, you can receive assistance through the state and you apply through your county department, your job and family service office. So the two of those programs do work together. Generally speaking, Medicare is your primary payer. Medicaid is the payer of last resort. If you have both of those, your costs are covered. But I do need to mention because Cleveland area is a MyCare area. So Ohio is one of a handful of states that is participating in a federal demonstration where they have combined Medicare and Medicaid to create Medicare Medicaid plans. And they're called MyCare Ohio. There are three options within the Cleveland area. And if you don't pick one of those and you're on full Medicare, full Medicaid, you're going to be put into one of those. You have the option to opt in or opt out for your Medicare benefits. But if you or you're helping someone that has both Medicare, Medicaid in the MyCare Ohio program, if you opt in for all of your benefits through your MyCare plan, there are some added benefits. And I know it's so much detail in so little time. So if someone is on a MyCare plan, has questions, please reach out to one of the experts to get that individualized counseling. Those plans are going to continue through 2025, but then those two will be ending. So we'll probably talk more about that in next year's session. But to answer your question, yes, you absolutely can have Medicare and Medicaid. And even if you don't qualify for full Medicaid, there's Medicare savings programs that if you have a little more income, a little more resources, you qualify to help pay for those costs. And even if you don't qualify for any Medicaid, you may still qualify for extra help to pay for your prescription drugs. So our motto, when in doubt, fill it out. See if you can get the assistance. And we can assist with those applications at OSHIP.
I love that. When in doubt, fill it out. That's a good motto for life. Here's another basic question, Amanda, but very important. Can I be on a spouse's health insurance and Medicare at the same time?
The answer is yes. So there's a couple things to consider when you have a employer sponsored health plan in play. So if a group is under size 20, so if they have 20 or less employees, Medicare is primary. So you're going to want to enroll in Medicare A and B because basically what's going to happen is the carrier or the company is going to process the claims as if you're enrolled in Medicare A and B. So you really want to make sure you have that coverage there so that you're not responsible for the 80% that Medicare generally picks up. But if the group is over 20, you can defer your Part B. Most people don't defer A because it's premium, but you can defer your Part B until you retire. So you're going to save that monthly premium. I would not say that it's necessary to enroll in Medicare Part B if you are in a situation where Medicare is secondary. So you can have both no matter what. I would only do it in situations where Medicare is primary. And your HR resource is going to be able to help you with that if you're unsure of if it's primary or secondary.
All right. The next set of questions are about customizing plans. Amanda, for someone with ongoing health conditions, what specific plan features should they prioritize?
So I think generally when you have ongoing health conditions, there's two things that pop into my mind that you're probably utilizing the most often. The first is prescription drugs. Chances are you're taking medications for those conditions. And number two is you're probably seeing some specialists for those conditions. So just not knowing anything else like upcoming surgeries or anything, I would say those are probably the two benefits that you're going to want to look at is, are my prescriptions covered? And then what copays do I have when I see my primary care or my specialist?
Okay, great. Of course, it's hard to anticipate what's going to happen in the future. Are there ways to anticipate future healthcare needs when you're selecting a plan, Amanda?
I think the good thing about the annual enrollment period is if something comes up mid-year, like yes, you can't make a plan change, but really this annual enrollment period gives you the opportunity to reevaluate your needs on an annual basis. Most plans like a Medicare supplement, like you're pretty much stuck in that plan. You can't go up or down in benefits on a med sup after your initial enrollment period unless you can qualify medically. But with Medicare Advantage plans, you can change every year. So if your situation changes, you always have the annual enrollment period, or you may even qualify for a special enrollment period throughout the year, make those changes.
Okay. And Chris, how can someone switch plans if they realize their current one just isn't meeting their needs anymore?
Yeah, well, you can do it independently. Amanda shared Medicare.gov is the federal web tool to review all of those plans. If you are confident in that selection, you can enroll on Medicare.gov's website. You can contact your SHIP, Ohio SHIP. We will go through the Medicare.gov web tool with you. Again, we want you to make an informed and educated decision. If you have done the homework, we will act as your fingers on that application. Or, as Amanda has shared, there are local agents that are there to do right by their consumers, know the local landscape, know the providers that can provide that guidance. Just again, be cautious of anybody that's calling you up unsolicited. No one should be showing up at your front door without an appointment. Just be cautious of folks that you don't know.
All right, we've got a few more questions and then we're going to turn it over to audience questions. So with our viewers, if you have a question, please put it in the chat and we will try to get to it in a few minutes. Chris, what are some resources that are available to help people compare and choose the right Medicare plan? Both of you have spoken about several during this, but maybe you could just list them once again for everyone.
I think the best tool to look at all the plans in one spot is Medicare.gov. Find plans, it'll walk you through, you put in your zip code, and then you put in, like for a drug plan, your specific medication, milligram strength, dosage. It'll take the 14 plans that are available in Ohio for 2025 from the least expensive to the most based on your medications. And then ideally, we usually take the top three and compare them side by side. And you can look at specific details. You know, Amanda mentioned earlier the importance of the formulary, and that is vital because, as she said, if your drug is not on that formulary, the cost of it is not calculated toward the cap. And additionally, we want folks to be aware of the formulary. You may be prescribed something new during the course of the year. Try to make sure that it is on the formulary. So that the same thing with the Advantage plans. The Advantage plans would go a step further and provide all the details of the very overwhelming number of Advantage plans that are in your county. So with that, I would encourage folks though to also talk to your providers to make sure that they are not only in network, which is vital, but also kind of feel them out to see if they're going to stick with that plan throughout the next calendar year. Plans can leave, or I'm sorry, providers can leave plans at any time during the year because those contracts don't align with the calendar year.
Yeah. And can you just tell us what a formulary is if someone's not familiar with that term.
Yeah, sorry. So a formulary is simply a list of medications that the plan covers. They're very comprehensive. Medicare requires every plan to cover medications in all classifications. So they're very
Mhm.
broad, very comprehensive to cover all medical needs.
Okay. Sticking with Chris for another minute, this question, what are some common pitfalls to avoid during the enrollment process?
Oh, so many. So what we often see, I mentioned just, getting a plan based on an advertisement or something that showed up or somebody that showed up, at your local senior center and not doing your homework, not making sure that the plan fit you as an individual. So we want to make sure folks are making those decisions. Also, if you have a retirement plan, we have seen folks see these great ads on TV, advertising, this over-the-counter benefit, groceries, this, that, and the other, and just enroll without thinking. And that takes them out of their employer plan, which may not be the best thing for them. So really, the hardest thing that we see during open enrollment is folks jumping into plans based on the marketing alone without doing their homework.
Right. And then this last planned question goes to both of you. What is the one piece of advice you would give to anyone who's feeling overwhelmed by the Medicare selection process? Of course, we're here to help them feel a little less overwhelmed, but some specific advice would help. So Amanda, why don't you go first?
Yeah, I would just say you're not alone. I mean, I talk to my grandma every single AEP and review her choices. And typically she does have to make a change because her medications have changed. So again, I would just find that local Medicare resource that can help make sure that you're not missing anything. We work with hundreds and hundreds of great agents. So finding somebody that's independent, and that would be my recommendation.
Okay, Christina?
I agree. And it can seem overwhelming, and many of the counties that are listening in tonight have more than 100 Medicare Advantage options. And, you get into this analysis paralysis. And that's where, Amanda's group, OSHIP, other respected and trusted sources within the state of Ohio are here to
Mhm.
help you narrow that down. That's kind of why I always appreciate being able to say a few words in the beginning. Just kind of take a step back. Do you want to be in option one, original Medicare, supplemental plan, and then just shop for the D plan every year? Or are you liking the Medicare Advantage plans? Less money monthly, kind of that you pay as you go, either the copays, the co-insurance. And really, as long as you are aware of all these possible out-of-pocket costs, any limitations the plans may have, you know that going into it. The plan is going to work well for you. And I think Amanda would agree, we're all there after the fact too. If you have issues as you're going through the calendar year with the utilization of the plan, you're not alone. Reach out to those
Mhm.
sources.
Right. There's so many good sources that are standing by to help people. Now we want to go on to some questions that our viewers have put in, see what's on our viewers' minds and what they are wondering about. And the first question is, how do health insurance brokers charge for their services? Is it a flat fee? If so, what can someone expect to pay for those services?
Yeah, I can take that since I work with the broker market. So brokers do not charge for their services. You won't be charged from the carrier. You're not going to pay like a higher premium. The carriers basically file broker commissions within their products. So there is no charge for you whether you work with a broker or you do not work with a broker.
Christina, did you want to add anything?
Yeah, the commissions are how the agents, the brokers are getting paid. I would, be cautious. There are some boutiques out there that might charge an upfront cost to help you review those plans, and I don't think that's necessary. There are many trusted resources out there, ourselves included, that do that at no cost to you. So
Mhm.
I would be leery of any upfront flat fees that are required to do something that's out there on the website.
All
Yeah.
right. Okay. This person is turning 65. They want to work until they're 67. Um, when do they have to sign up for Medicare? Do they have to sign up when they're 65? I think we touched on this earlier, but maybe you could go into a little bit more detail or just tell people again.
Yeah, so again, I think that it goes back to your group size. So if you are with an employer that has under 20, you'll want to sign up for Medicare right away, your A and B. And then when you retire, you can decide if you want to get a Medicare Advantage or the Medicare Supplement and Part D plan. If the group is over 20, you can save that Part B premium until it's time to retire. And then at that point in time, you can decide Medicare Advantage or Med Sup and Part D.
All right, sounds like a good plan. Are
I
there
might
any?
just add real quickly, we get so many calls from people that have health savings accounts. So
Mm.
the only caveat with that is that you'd want to stop paying into your health savings account at least 6 months before you're going to sign up for your Medicare Part A benefit. And your HR department's going to be a good resource for helping you wiggle through those IRS rules.
All right, great. Are there any Medicare Advantage plans that offer personal emergency response devices in the Cleveland market? I imagine they're talking about the kind of thing that you hit if you fall and then it calls for help automatically. What can we tell people about that?
There's definitely carriers that cover those. So each carrier has their own what we call supplemental benefits. So those are benefits that Medicare does not cover. So every Medicare Advantage carrier has to cover Medicare's A and B benefits. So that the A and B benefits have to be covered by every single Advantage carrier. Beyond that, carriers can add supplemental benefits. So there are some that have the per system. You would just have to weigh, do those plans, what you're giving up supplemental on another plan, is it worth that per system, or is it worth just paying that monthly premium? But yes, there are some that cover that.
Okay,
And I
great.
would add to that exactly. So what we really want folks to do when they're shopping for their Medicare Advantage plan is make sure their health, their medical, their prescription drug needs are taken care of first. If the
Mhm.
goodies list has the gym membership, the grocery thing, the alert, great, but please remember the primary source is to have good health insurance.
Yeah.
Very important. This person writes, for standard Medicare, I'm already on Part A with employer coverage. Are there any issues with delaying Part B and Part D?
I think Amanda talked to this as well. Yeah, as long as you're working, you have that current group health coverage. So you just take A, you've probably paid into it. There's no premium. It's sitting there secondary. You wouldn't need to sign up for Medicare Part B as in boy and the drug benefit, the D as in drug, until you decide to retire, quit, walk off that job. You would have 8 months special enrollment window, but we encourage folks to be proactive. If you know you're going to retire in June of next year, talk to Social Security at least by May so you can set it up to be seamless. But no, if you have current group health coverage and then you sign up for Medicare Part B and Part D, because you're leaving that current group, there is no delay, no penalty for keeping that coverage. Now, if you're not working at 65, there's no current group coverage from you or a spouse. You could face penalties and delays in getting Part B and Part D.
And you definitely want to avoid those penalties.
Correct.
Right, right. Okay, next question. Can someone switch back and forth between Medicare supplement plans to Advantage plans and then back to Medicare supplement plan? And if so, how many times can you switch back and forth?
I'll try to start. That's a big question. So yes, during the open enrollment period that we're in right now, now is the time. Do you want to be in original Medicare or do you want to be in the Advantage plan? So every year you can make that decision. Now, if you go back to original Medicare, you likely want a secondary insurance. However, Medicare supplemental insurance, the MedSup, Medigap, they will medically underwrite. They may not issue that policy unless you're in a guaranteed issue situation. So, for example, what if you got a letter already saying your Medicare Advantage plan isn't coming back? They're leaving your area. If you choose to go back to original Medicare, you would have guaranteed issue for certain Medicare supplemental insurance plans because of that situation. And then you'd probably want to pick up your drug plan. Um, and then going from Advantage plan to Advantage plan, there's no medical underwriting, right? As long as you live in the county that they sell, you have Medicare Part A and Part B, they're going to take you. So we'd like for everybody to pick the best plan now for January and keep it all year. But we have the Medicare Advantage open enrollment January, February, and March. We have ongoing special enrollment periods. So if something unique happens in your situation during the course of the year, reach out and ask us, what opportunities you have with those situations.
Okay, thanks for that fantastic information. Another question from our viewers. If I get a supplemental plan, does it cover prescriptions?
It does not.
No.
Yeah.
No.
Medicare supplemental insurance does not include a prescription drug benefit. Eons and eons ago, before Part D existed, there were 3 plans that did, and I actually saw one a couple weeks ago. But no, there is no prescription drug coverage in those supplements. So you would want the standalone Part D.
All right. Should everyone approaching 65 apply for Medicaid automatically? I think you've already answered that one, but then the person also wants to know, should they apply for MyCare Ohio automatically? And is MyCare Ohio income-based? And I think you said earlier, MyCare Ohio combines Medicare and Medicaid.
Correct. So yeah, not everyone has to apply for Medicaid. Now, if you're limited income, limited resources, absolutely visit your county job and family service office to see if you can qualify for any benefits. If you already have full Medicaid and you join Medicare, if you don't pick a MyCare Ohio plan, they will auto enroll you into one.
All right. Amanda, did you want to add anything?
No. Nope.
Okay. All right. Great. Great. Can a person receive a healthy benefits card? I think they mean a health benefits card if they have chronic heart disease.
It's a grocery card. So yes, so certain plans have what they call a grocery allowance, and you can qualify for them if you have certain medical conditions. So it's going to be different by every carrier as to what conditions qualify, but that has definitely been a hot topic and benefit for the last few years. So yes, those are definitely out there. It just kind of depends on the plan.
Okay, so healthy benefits, that refers to a grocery plan.
That is what I'm assuming they're referring to. Yes.
Okay.
Yeah. And
And
I will say we recommend Medicare.gov for reviewing the plans. Those are added benefits. You really need to call those plans individually to find out the specific details and criteria for those added benefits.
okay. And I think we've touched on this last one, but we'll throw it out there again. Where to find brokers that will help you through this?
So again, I think, Chris, you've said that OSHIP has a list of agents that work in the Medicare market. Again, we'll send out the link to our website that has some of our agents listed on it. And then honestly, I hate to say Google it, but I feel like if you Google it, chances are you'll probably find a decent agent. And I would focus on local. Again, local, somebody that like you could literally walk into their office. Versus the 800 numbers. Because if you Google it, you'll probably find an 800 number first. But look for the local agents to help you.
Yeah.
Okay.
Our
So
website, insurance.ohio.gov, as Amanda said, has an agent locator. So that would be someone that's licensed within the state of Ohio.
okay, for someone people aren't on Google a million times a day like I am, you should probably Google what Medicare broker Cleveland, Ohio. Put those words in. Would that probably do it?
Now, anytime you put Medicare in Google, you're going to get a lot of
Yeah.
marketing.
Well, okay. So
Yeah.
what is the search to do that?
I would
search?
probably go to the site that Chris recommended. So again, we can add those to the chats so that you guys have them.
Okay, terrific, terrific. And we do have more questions coming in, which is fantastic. Oh, just a minute. Does Medicare cover facility charges that are added to billing claims by a provider? So it's about facility charges and if they're covered by Medicare.
Typically, when we're talking about facility charges, it's a Medicare Part A. You're inpatient at the facility, I believe is what they're referring to. Medicare Part A will cover the inpatient hospitalization. It'll cover inpatient skilled rehab following a hospital stay. And it will cover some home health and some hospice. So the facility fees are typically under Part A. I'm questioning though if maybe they're talking about, we also call that kind of a boutiquing fee. Some providers will only take on a certain number of clients in an outpatient setting, and they refer to that sometimes as a facility fee, in which case Medicare would not cover that.
All right. Well, we've reached the end of our questions from our viewers. Thanks, viewers, for all those fantastic questions. We're moving on to the next segment, but first, Amanda and Chris, do you have anything else you want to add?
I'll just say thank you again for the opportunity. Don't feel overwhelmed. We're here to help. Contact OSHIP or a trusted source. But please do take the time during this open enrollment period to review your health and drug needs to see if you need to make a change before the end of open enrollment.
Amanda, any final words?
No, not at this time.
Okay. Well, thank you so much. And I'm going to turn it back over to Eric.
Awesome. Thank you, three. That was a great expert round. As a reminder, you will have access to this event recording and the Q&A and other helpful resources on the resource page. The link is in the chat, and you'll get that email early next week. Next up, let's talk about drug plans. What should you consider when choosing a drug plan, and how do you know if your drugs are covered, and what is new for 2025? To give us answers to these and many more questions, Amanda McFarland stays here, and Katie Goff joins us from Medical Mutual. Katie Goff is the Medicare Pharmacy Director at Medical Mutual, overseeing operations, quality initiatives, pharmacy information, and data analytics. Katie has been with Medical Mutual since 2015 and has more than 20 years of experience in the Medicare industry. Katie, welcome to the panel. Julie, the floor is yours.
All right. Welcome, Katie and Amanda. I'm sure this is going to be another fantastic session. We've heard that there are important changes coming to Medicare drug plans in 2025. Katie, could you please walk our viewers through what these changes are and how they'll affect enrollees?
Sure. Yeah. Thank you, Julie. Thank you, Eric. I appreciate being on today. As everybody has been saying, there's lots of big changes happening in Medicare Part D. Many of them you've already heard about, things on the screen here. Were already mentioned by Amanda and Chris, but I'd like to talk a little bit more in depth to some of this just to explain a bit further. So one of the biggest ones, and we've heard this already, is the reduction in out-of-pocket, Part D out-of-pocket costs. So this is an annual out-of-pocket spend, a responsibility that the member pays. That is being reduced for Part D drugs. As Amanda said before, this is plan formulary specific drugs. It previously in 2024 is $8,000. So this is a significant reduction and a great benefit and news for our members. The second piece, and I will talk a bit more in detail in a future slide, is the Medicare prescription payment plan. So this is the option that allows people to spread their prescription drug costs over the plan year and get billed monthly installments by their plan. And then the third thing that's a big change is the removal of the coverage gap. I think Chris mentioned it being the donut hole. So this is a phase of the benefit that was always confusing because it had a lot of changes, or it confused members, and it usually increased costs. So that is going away for 2025, and all great news. And on the next slide, we can talk a little bit more about the Medicare prescription payment plan. Now, it's a voluntary program that helps spread the cost, like I said, over the calendar year. And anyone can sign up for this plan. You can do so by visiting the plan's website. And basically how it works is, after you opt in, you no longer pay the pharmacy for your prescription. Instead, you'll get this monthly bill from your plan. The bill will be based on what you would have paid for your prescription, plus any remaining balance from the previous month, divided by the number of remaining months in the calendar year. So you can sign up now or anytime during the plan year. The further into the year the plan year goes, the less months there are to spread that cost share out. So, for those of those people that are interested or likely to benefit from this program, you should consider opting into it soon into the year rather than later into the year. And the program will not benefit all people. There are some examples on the screen here that it shows who might it not be a good fit for. So for those people that already have low annual drug costs or costs that are relatively the same each month, or maybe you can comfortably afford the $2,000 annual out-of-pocket max. Remember, once that $2,000 is met, then the covered drugs go to zero. So that's an awesome benefit. And so if you're thinking about that, then and you can afford it, it's probably not the program for you. If there's people who are thinking about opting in late in the year, I kind of hinted to this just a bit ago. This program's probably not for you just because you've got very limited months to spread that across. And CMS even recommends, people coming in late in the year, not really opt into this because it's not really a benefit to you. And then there's people who simply just don't want a bill, right? They don't want another bill. They don't mind how they pay for their prescriptions already. They don't really have an impact to their monthly cost share, right? It's important to note that the program does not reduce the drug cost obligation. It only spreads it out over the year. So it's just basically delaying what your responsibility is over that period of time. And then there's other, we talked about limited income people and those receiving extra help. People on that program already receive reduced cost share for their prescription drugs. They're not excluded from applying or opting in, but they may not benefit from it just because it is a collection and a spread out over the year, and they may already be getting it at a cost that they can afford. All right.
Thank you so much for that information. That was a great overview.
Sure.
And now we're going to dive into some questions. Katie, you're still up. In response to these changes, do you anticipate that insurers will change pricing and coverage for Medicare Advantage and Part D plans?
Okay, so this is a yes or no, yes and no. So we're seeing both things right now, right? This is a big year, big changes in Medicare. We see some plans making big changes, increasing and adding deductibles that weren't there before. Some plans are staying relatively the same. Again, I think the consensus was from Amanda and Chris, right? You really should be checking this every single year. Whether you're brand new this year and lucky to start off the benefit in 2025, or you're a veteran at this and just have questions, still very much encourage you to evaluate your benefits each year for this reason. And this year is no different. The Plan Finder tool, we talked about Medicare.gov. You can go on plan websites, talk to a trusted broker or agent to be able to find what exactly is the best plan for you and what's changing with those plans.
Next, we have a Medicare Advantage plan. Back to Katie. Can people with Medicare Advantage plans expect that the coverage for their doctors or other providers will change due to the cap?
So, prescription drug, what I'm here to talk about is mainly focused around the prescription drug portion of the plan. So we don't anticipate provider changes as a result of these big changes to Part D, right? So the plans will still have to require adequate access to medical providers as well as pharmacies. And again, these are things that can be looked at, but we don't anticipate changes on the provider side, doctors or hospital systems as a result of these Part D changes. No.
All right, that's good to know. Amanda, here's a Medicare Part D question for you. What are some of the primary factors older adults should consider when choosing a Medicare Part D drug plan?
Yeah, so again, I think that this goes back to when we were talking about the list of medications. I cannot stress how important that is. And the $2,000 max out of pocket means nothing if your drugs are not on that carrier's formulary, because you're going to have to pay for everything if they're not on that list. So first, I cannot stress enough, like making sure that the drugs are on that formulary. This year, more than really I've seen in the past 10 years, I think that there's been a huge change in the competitor market on how they're covering drugs. Maybe before it was a copay and now it's a co-insurance. So if you don't know what that means, a copay is here, you're going to pay $10 for this. Whereas co-insurance is if it's 20% of $1,000, you're paying $200 of it. So we've seen some big changes in the market this year. So doing that Part D analysis and determining what medications are covered, and then what they're going to cost you, that is what I would recommend, regardless of your age. It doesn't really matter. That is most important.
Our viewers also want to know, how can enrollees determine if a drug plan covers their specific prescriptions and what they should look for in a plan's formulary? Katie, do you want to take this one?
Yeah, so every plan is required to submit their covered drug list, that formulary, what we've been talking about here, and their network pharmacies, along with the pricing associated with them, to Medicare. So, and that's the information that is driving what gets displayed in Medicare.gov, the Plan Finder tool. So when Chris and Amanda said earlier, really going out there and evaluating your options, it's one of the better sources to see everything in a snapshot. This is the tool. So it tells you exactly how a plan will cover a certain medication at a specific pharmacy even. If there's interest in certain plans, each plan also has similar search engines, and they're available on their plan website. You enter in list of medications the pharmacies utilize, and it shares how that's covered. A lot of times, these tools were also going to be sharing not just pricing, but it includes what we call utilization management tools that get applied to specific drugs on a formulary. So utilization management tools are things like prior authorization requirements or step therapy requirements, or things that if a drug's not on the formulary, it tells you how to go about getting a formulary exception to see if that drug can be covered. So those are all things that are available out there for a member to search.
Okay, we've told people to check and make sure their medications are on the formulary, but what if they're not? What steps should someone take if their medications are not included in a plan's formulary, or if coverage changes? Katie?
Yeah, so if the drug coverage has a negative change from this year to next, plans communicate that information with you. So you can take steps with your doctor and working to get on an alternative drug or requesting a formulary exception. Maybe you can't take the formulary drug because you have an allergy or other type of reaction to it. Your doctor can file for a formulary exception that can be reviewed by the plan and then determine whether or not the plan will cover it. So those are some of the things that can be done to evaluate coverage issues and changes.
Great. Katie, can you please explain how drug tiers work and how understanding them can help people select the best plan for their needs?
Yeah. So plan formularies typically cover drugs on different tiers or cost sharing levels. That those tiers represent different cost sharing levels. Most plans have 5 or 6 tier formularies, where tier 1 represents the least out-of-pocket costs to the member, and tier 5 and 6 represents the highest cost to the member, typically. There's some special situations where there's special tiers that are in the higher tier, but it's usually well denoted in marketing material posted to the plan's website on plan formulary that explains what that representation is. And also in other plan material helps to say what exactly that cost share would be. So utilizing generic drugs whenever possible and making sure those generics are covered by your plan is super critical. Again, utilizing the tools we talked about and getting with a trusted broker and sales agent that can help you select the plan that's specific for your needs.
All right, Amanda, we definitely want to have you jump in here. What should individuals do if their prescription needs change throughout the year? Can they adjust their drug plan mid-year?
So again, typically you're locked in after the annual enrollment period unless you have some type of qualifying event. So you're going to be locked in. But like Katie mentioned, with our formulary, we are required to cover drugs in every therapeutic class. So meaning for every condition, we have to cover some type of medication that treats that condition. Typically, it's a long list of drugs which within each therapeutic class. But you would want to, first step would be talk to your doctor about the drugs that are covered under that carrier's formulary. And if for some reason they don't work, you would follow the formulary exception request. Your provider would initiate that to say, okay, maybe we've tried these, or this is why those other medications don't work, and we need an exception to get this particular medication covered. So you can't switch plans. You would just have to see if your carrier could potentially cover that medication.
Okay, so that would be the way to handle that situation.
Correct.
All right. And Amanda, again, what are some common mistakes that people make when choosing a drug plan, and how can you best avoid them?
I think, again, they kind of look at, if you go out there and you just look at a carrier's copays, meaning what are you going to pay for those different tiers on the formulary, just purchasing based off of that is not sufficient enough. You have to look at your particular medications and make sure that your particular medications are covered. I know one of the members said, why is my drug cost in excess of $2,000? When you said that there's a $2,000 cap. Well, that's because there were certain medications that aren't covered on that carrier's formulary. So making sure that those drugs are covered to hit that 2,000 cap is going to be critical.
Well, now we have some time to take some audience questions. So here we go with the first one. Is there a scenario where the beneficiary pays less than 2,000 Is there a scenario where the beneficiary pays less than $2,000 in order to reach the $2,000 cap? I heard some enhanced drug plans offer this.
That is that is true. We won't go into how complicated it is to actually calculate the max out of pocket on that 2,000. But basically, the easiest way to explain it is the government comes out and says, here's our plan. And it's a $590 deductible. And then all other drugs are covered at 20%. If a carrier offers an enhanced alternative, meaning not that benefit, then the calculations are not just what the member's paying. They look at what you would have paid under the enhanced plan, and if you would have paid more under that model, it applies to that 2,000. So we have seen examples where we have copays on our plan, and the members max out of pocket maybe 400 with us because we have copays, and other carriers they may be looking at the 2,000. So again, it's all drug based, but Medicare.gov does that work for you, so you don't have to get your calculators out.
Oh, thank goodness.
And I'd like to add just a little to it too, and Amanda did a great job. So it really is basically, in essence, without getting math involved here, is really looking at making sure this enhanced plan that has to be equivalent to the Medicare defined plan that Amanda talked about, that our plan, because we have to be equal to or better than that, if we're going to say we're covering and have enhanced coverage as a plan, we cannot let our members pay more than they would if they were on the standard plan. So there's always a comparison with each one. So that's why sometimes you can hit your maximum out of pocket, because in those cases, what the plan pays will apply to the $2,000 max. So making the members out of pocket actually less than $2,000 and getting to the $0 cost share quicker. But it is complex. I try to keep it as simple as possible, but it is really, the essence of it is just making sure we're not disadvantaging our members by saying they have to pay this $2,000, when in fact, if we would have carried their drug coverage through that same benefit, the defined standard benefit that Medicare does, then, those members would actually have paid less in that situation.
All right, terrific. Next question from one of our viewers. Are infusion treatments for Alzheimer's considered to be drugs that fall under the $2,000 Part D cap?
So we'll confuse this even more. There are Part D like dog drugs and Part B like boy drugs. So B like boy falls under your original Medicare benefits. So typically the easiest way, most of those drugs are administered at a doctor's office or a house or a hospital setting. There are some instances where that's not the case, but I think generally that's a rule of thumb, is if it's being administered at a hospital or doctor's office, it's going to fall under the Part B as in boy, and the 2,000 only applies to the D as in dog.
Correct.
Okay. Katie, do you want to add any more?
Nope, Amanda did a great job.
All right. Yeah, that was terrific, Amanda. Here's our final question. Where do you go to find the drug formulary for your plan? And once again, we said earlier that a drug formulary is just a fancy term for a list of drugs that your plan covers.
That's correct. Yeah. Every plan is required to post their formulary on their website. So it should be easily accessible. You can look it up there. If you are on Medicare Plan Finder and you see the plan you're interested in, it will link you to that plan's website and to that formulary. So everything's connected, and you should be able to access it no matter which area you go to.
Right. Amanda, anything to add?
Nope.
All right. Well, that's the end of our viewer submitted questions. Fantastic questions, everyone. There was just so much information there and really got to the nitty gritty of a lot of things. Amanda and Katie, any final words?
No, I just wanted to thank you for having us again. I know this is probably being in Medicare since Part D first started. This is by far the biggest year in changes since it started. So it's really great. It's a great opportunity for members. For those of you that have been on Medicare and listening in, this will be quite a shake-up year. You will likely have lots of questions. We just encourage you to contact us, get in touch with OSHIP, whoever, just get in touch with someone that can help you through it, because it is quite different than the Medicare of days of old.
Yeah, absolutely.
Amanda, any final words from you?
No, Katie said it well.
All right. Thank you so much, Amanda and Katie. This was tremendous. And Eric, back to you.
Awesome. And thank you to all of our incredible speakers on their insights and expertise today. Now, we want to make sure that you have all of the tools you need to confidently choose your plan for 2025. As a reminder, our resource page that is in the chat is filled with in-depth information, and we'll also be sending you that email with a recording of today's event, the comprehensive Q&A, and a whole bunch of other stuff early next week. Before we part ways, we want to let you know that your feedback matters to us. We want to know if today's session was of value to you and how we can improve this in the future. Take a moment to share your thoughts in the survey. The link is in the chat right now, and you'll also receive it in your email. And once again, a heartfelt thank you to our sponsors who made today's event, Medical Mutual and the Ohio Department of Insurance. Your support made today possible. That is a wrap, my friends. Thank you for joining our Guide to Medicare event. We hope to see you at our next gathering. Until then, get out and enjoy the fall weather, and we'll see you soon.